This is kind of a quick introduction to 12-lead EKGs and patient assessment, why we need them, how we do them, where we do them, some of those quick questions we're going to answer here. So first off, why do you even need a 12-lead EKG? The answer is that the limb leads don't provide you with a clear enough view and enough views. So you need the high definition view of the 12-lead where there's no filters, and if you see 1 millimeter of ST elevation, it really is there in 12-lead mode. In simple limb lead mode, it's not there. You can't rely on it being there. So why we need one? Again, high definition and then more views. The limb leads give you 3 or 4 views. The 12-lead is going to give you 12 views of what's going on in the heart. When do you need to get one? Anytime you suspect cardiac ischemia, we would suggest that you get a 12-lead before you start treatment with nitroglycerin if at all possible. Sometimes nitroglycerin will relieve any changes that are on that 12-lead, and we'd like to capture that beforehand. You can do a 12-lead rapidly enough, efficiently enough that it doesn't impact your patient care, and it may actually help that patient long term to have recorded that. But it should have a real low threshold for doing a 12-lead. If you think you might possibly need one, if you think there's any chance there's cardiac ischemia involved, get a 12-lead. It's fairly simple. So when do you need one? Quite often. And repeat ones. Every time you run another set of vitals, another blood pressure, run the EKG real quick. Where do you perform the 12-lead? It should be wherever you need it. You can certainly do one quickly in the house. If you begin treatment in the house, you can do one in the ambulance. When the ambulance is moving, you're going to get a little bit more artifacts sometimes, a little bit more motion. But again, you can time that and work on getting your 12-lead when you come to a stop, when you're going to listen to lung sounds, or when you're going to get another blood pressure. What do you need to get a 12-lead? You need the standard limb leads in place, as well as the additional 6 wires for chest leads. And you need some good skin prep. We probably don't do very good skin prep. If you watch videos from Physio or from Zoll, they emphasize skin prep. And real quickly, you can just take the plastic off the back of the electrode patch and just scrape some skin, just briefly enough to get you some good contact. And find places where there's not body hair or places that are not very sweaty. Get much better contact and a much better tracing. Who can get the 12-lead for you? Well, certainly any paramedic can get the 12-lead for you, and your EMT partner if you're working on an ambulance service. The EMT partners should be able to get those. Now realize that many EMT programs aren't teaching 12-lead acquisition as part of their curriculum. Well, we do, and we're also teaching it in our continuing ed. So our hope would be that many of our firefighters and all of our EMTs would be able to assist with that. How do you get a 12-lead? How long does it take? Pretty simple to acquire one. Again, hook up the wires, have your patient remain still, try to minimize any movement, push the 12-lead button on the monitor, and it will take about 10 or 15 seconds. How long does it really take, start to finish? Probably 2 or 3 minutes. If you're working on it rapidly, 2 or 3 minutes from the time you decide you need one until you have the printout. So again, just kind of a quick overview. Why we're doing this, we're going to do several more of these presentations about the specifics of analyzing a 12-lead and all the information that you can obtain. We're looking for 12 leads for evidence of injury, ischemia, or infarct. We're also looking for conduction delays. We're also looking to get an excellent view at what the actual rhythm is. In some cases it's difficult to tell from one lead, but you can certainly get a better look when you get 12. So that's just kind of the start of several in a series on 12-lead EKGs.